All right, well, the Centers for Disease Control is issuing a warning about deadly mosquito-borne viruses, one that's made its way to New York.
Yes, sloth fever can also lead to more serious conditions like encephalitis and meningitis. So joining us this morning is the Director of Infection Prevention at Northwell Health, Hannah Newman. So good morning, Hannah. Thanks for being with us.
Thank you for having me.
All right, so let's talk about this sloth fever. It's native to the Caribbean, Central and South America. 21 people returning from Cuba all tested positive for this. So what is sloth fever and where did it get its name from?
Sure. So this is a vector-borne illness. So this is something that can be transmitted from an insect bite. They call it sloth fever because when it was discovered in the 50s, it was found in sloths. But don't worry, we don't have to worry about sloth bites. This is really something that's insect-borne.
Oh, okay.
All right, and it's spreading as well. What's causing the spread? And is this a stronger virus than some of the others that we've been concerned about, West Nile, those type of things?
So it's very similar to West Nile and other vector-borne illnesses like chikungunya and dengue. The good news is it's really travel-related right now. We're not seeing local transmission. So this is happening in these endemic areas or areas where there are outbreaks.
Yeah, and expectant mothers really should be concerned about this, right?
Yeah, there is a concern for expectant mothers because of the potential for mother-to-fetus transmission. It can cause very severe congenital defects like microcephaly or even fetal death.
Yeah, they're actually looking at one case in Brazil right now that seems to be a transmission from a mother to the fetus. So again, this is something that pregnant women should really think about traveling to these countries.
Absolutely, and if they are going to be traveling to areas that experience any of these vector-borne illnesses, really prevention is key. So we want to make sure that insect repellent is used, long sleeves and pants, avoiding times where mosquitoes are more active like dusk and dawn. And then, if there are concerns for mosquitoes and lack of mosquito control, you can use things like nets over beds and keeping the windows and screens closed.
Yeah, and well, here at home, that's obviously something that we're all very familiar with, especially being familiar with West Nile virus. But the thing that's a little bit different, the symptoms show up, or they take longer to show?
So they usually show up within 4 to 10 days. That's the incubation period. However, what's different about this is that you can have recurrent symptoms days or even weeks after the initial illness.
Okay. What are some of those symptoms?
So about 60% of people who are infected will be symptomatic, and that can manifest in ways like fevers, chills, body aches, muscle pains, joint pains, things of that sort. There are other symptoms like sensitivity to light, pain behind the eyes, nausea, vomiting, abdominal pain, and in very severe cases, of course, we've talked about encephalitis and meningitis, and in very rare cases, death. How
do they test for that and differentiate between West Nile, sloth fever?
It's hard because a lot of these illnesses manifest the same way. So, the healthcare provider is going to look at things like the symptom presentation and travel history and rule out other causes. So right now, the recommendations from New York State Department of Health and CDC is to rule out dengue first. And if that is, tested negative, there is a test available that it can be sent out to look specifically for this illness.
All right, so, we've been talking about sloth fever, oral push virus. But the mosquitoes are also carrying a lot of other things. Now we're looking at triple E, right? The Eastern equine encephalitis. What exactly is that?
This is another vector-borne illness, and it's very rare, but it can be very serious. There's a higher mortality associated with this. This is something that can transmit between mosquitoes and birds, and then with that bite, it can actually infect mammals like humans and horses. That's where the equine comes from. And this, other very similar manifestations in terms of symptoms, but the concern is that there are more neurological symptoms that are associated with this, and it can be more severe in a higher proportion of the cases.
West Nile, though, is obviously more common in our area.
That's definitely the most common mosquito-borne illness.
But we still have to be concerned about that.
Yeah.
Absolutely. There was actually a case in New York. So This is something that's very rare. It's a low risk to the general public, but it still exists. So it's important to know the risk factors and the symptoms to be aware of.
All right, let's talk about the other elephant in the room.
Yes,
With
sir.
school back in, there's been an uptick in COVID cases. What should we be looking out for here?
Well, the good thing about COVID is that we've experienced for a while. I feel like we're very familiar with the symptoms. As the winter months come and school gets back, we're going to have more people congregated inside together. And of course, anytime you have people together, there's concern for more spread. So really here, looking for the common symptoms of COVID, the respiratory illnesses, making sure that if they show up and you have access to testing, that's really the best way to figure out if you're sick. Really, with any febrile illness, you want to be isolating, especially from people who are at higher risk, and then consulting your healthcare provider if there are serious symptoms that occur.
Is there an updated vaccine, and should we wait for that as school starts?
There is an updated vaccine, and we have been anxiously awaiting this availability. And just yesterday, I believe CVS actually mentioned that they were receiving this. So Vaccine Finder is a great resource to look and see where it's available. It's recommended for everyone above the age of 6 months to get this because it's protecting against new strains that weren't previously protected from. And that's a good time to also put a plug for the flu shot because it's that season as well coming up.
All right, Hannah Newman, as always with Northwell Health, raising health for us this morning. We appreciate it.
Thanks
it's been a pleasure. Thank you.
Thanks for your time.